Thank you, Honorable Minister, for a very important question of small islands. And if I can give examples, maybe we are talking about Seychelles, Mauritius, Comoros. You face unique challenges such as climate change, limited healthcare infrastructures, and vulnerability to health emergencies. So, if elected, I will ensure these nations receive a targeted support to address these specific needs. First, I will advocate for tailored strategies like strengthening your health system, improving access to essential medicines. I know small islands depend a lot on imported foods. Unfortunately, these are seasoned foods which come with a lot of salts, increasing NCDs. Will focus on training and retention of your workers. But the other thing is an innovative method like telemedicine or artificial intelligence, because you can cater with telemedicine, do consultations with neighboring nations while building your workforce and capacity on health or human resources for health. So you have specific needs. We'll make sure that you get preparedness with all the health emergencies, because you are prone to preparedness like any other country. So prepare on surveillance, which has to start now before the emergencies start. We'll assist recognizing the vulnerability to climate change. So I will support development of climate-resistant healthcare infrastructures, build on early warning signs. And lastly, I'll try to prioritize integrating small nations into larger regional health networks, ensuring you have representations during decision-making bodies, because this is where your voice has to be heard and have the data. Thank you.
Thank you, Professor Jacob. We now ask South Africa to ask the question.
Thank you very much, Professor. Do countries need to be rich to implement universal health coverage for their citizens? Why are countries on our continent which have got universal health coverage so few? Thank you very much.
South Africa, just one question. Can you limit your question to one?
It's one question divided into two, Honorable Chair.
I'm sorry, just one. Which one of the questions you want him to answer? Countries rich or no. What? Which question?
Okay, I was asking whether countries need to be rich in order to implement universal health coverage, and why in our continent they are so few.
No. Please answer, Professor Jacob.
So which one, the rich one or the... No, Honorable Minister, thank you for the very good question. And does the country have to be rich to have universal health coverage? No, let me maybe start by, I firmly believe that primary health care and universal health coverage, one, they are inseparable, and they are foundation of achieving an equitable, sustainable health system. So my vision of is just all about planning. I'll give you an example. In Tanzania, we've made a significant stride in this area by having we call it senior advice on health policy, where we expanded our primary health care infrastructure to underdeserved areas. Because one of the challenges when I was moving around, one thing, you have to build on your community health workers, because these are the people who have the trust of the villages or the underdeserved They are the people who are communicating with your general population every day. So equipping the frontline workers, like community health workers, and there's other thing which unfortunately is not very prominent in Africa, they call nurse practitioners, because you don't have enough doctors. So if they get training on basic things like immunization, maternal and child health, health education. So these efforts will improve access, but the country has to be rich. My personal experience, I'll say this. One of the things about health insurance, I don't think we've given enough education. You know, I've moved around in most of the member states. You find our members of national health insurance, they are those who are sick. So you have 80% of your members, they are sick people, and only 20% are the healthy ones, and these are the mandatory ones. So I think it's all about health education to our people. They should start getting insurance before they get sick, because it becomes even more expensive for the national insurance, and that's why most of them, they don't succeed. So at the regional level, my priority will be to try to scale up and use some context-sensitive models. And I'll work with you, honorable ministers, so we can discuss. We have got 47 member states with different economies, different population. Talking of Seychelles, 100,000 people. Talking of Nigeria, 220 million people. So each country has to deal specifically
Professor
what
Yacob.
are the challenges and how we can solve them.
Thank you very much. Cameroon, you have the floor. Cameroon, lucky today.
Thank you. Merci.
Thank you, Madam Chair. I have a simple question for the candidate. What can he do to enhance the impact of the regional office in shared initiatives among several countries? We have been working to tackle epidemics and on vaccinations with certain countries, but we can't quite clearly see the impact of the regional office in this. So what is he going to do to enhance its visibility and impact?
Question que j'ai posée, madame.
I just asked a question, madam.
Qu'est-ce que le candidat va faire?
What will he do to enhance the impact of the regional office on shared initiatives among several countries, especially tackling epidemics and on vaccinations?
Can you, Cameroon, repeat the question? Just only the question, not the background.
Thank you, Madam Chair. I wanted to just ask the candidate, what will he do to enhance the impact of the regional office in initiatives that involve several countries, especially when it comes to tackling epidemics and vaccination? Because in our sub-region, especially Chad, DRC, and Niger, we have joint campaigns, but we're not quite seeing the impact of the regional office in these initiatives. What is he going to do to enhance that? Thank you.
Thank you, Honorable Minister, for a very pertinent question about, I think if I got it to you right, is your representations of the countries which you have mentioned. I think my response will be, if elected as a regional director, one of the first things will be to sit down with the members of the Secretariat, the members who I'm going to meet them at Brazzaville, and see, because we are all aware of the restructuring, reorganization, which is happening at the HQ, and I'm sure we have to get prepared with the 6 regions of the WHO. So I will sit down with the members, see how the organogram will look like, discuss openly with everyone, listen to member states. And I think from there, I will be in a better position to see what you are saying, which is very important, the equal distribution of the positions. We are 47 member states. I think regardless of the size, the economy of your country, this is our organ. All of us has to be there.